microdosing these drugs, it's just what they're usually doing is using just a smaller dose than what you usually start on. And the
Mhm.
idea behind it is that, well, if you're using a smaller dose, you're getting less of it, and it's the dose is the poison, and so on and so forth. But in reality, if you're taking the drug, we're increasing the amount of GLP-1 in your system. You're getting that exposure to it. So if it's going to have some kind of negative effect, really we're going to be splitting hairs of whether you get it at a low dose or you get it at the higher dose. And so
Yeah.
it's kind of this, you know, it interesting, but also just it, we're not really kind of getting any kind of particular benefit either way or either side of it. Does microdosing do anything special? There's no indication as to why. We don't have any studies to say that it does.
Mhm.
In practice, I have people that are on, say, Wegovy 0.125 because that's all they can tolerate, and they're having
Uh,
great effects.
uh,
So again, it's just that finding that dose that works for you. But
yeah.
at the end of the day, it's nothing special. It's something that I think has been very hyped up by a few celebrities to sell a product that really isn't going to do anything special.
So a microdose might work for you if you're someone who can't tolerate the starting dose.
Totally.
Might
Absolutely.
it might make sense, but someone who takes
But in that case, it's not microdosing, it's personalized medicine.
well, that's a personalized right, that's a personalized dose. So the starting dose of tirzepatide, Zepbound's 2.5. So if somebody wanted to take a microdose of compounded tirzepatide at like a 1.0 milligram level,
Mhm.
um, it's possible that they could get benefit from it, but it's also possible that it's not enough to really do anything for anybody.
Exactly. For a majority of people, like 2.5 is kind of the minimum dose that we get some kind of effect at.
Yeah.
And the studies bear this out as well. 5 milligrams is where we get the most benefit from a diabetes perspective. As you
Huh.
go up on the dose, you get a little bit more benefit, but
Mhm.
5 milligrams is kind of your bang for the buck if you're using it solely for diabetes. The
Mhm.
15 milligram, as you go up in terms of weight loss, I can't remember exactly how much, but at each like 5, 10, and 15, there was like a doubling of the amount of weight loss that was lost at
Huh.
each dosage. So
Huh.
the studies bear out that, yeah, like you'll get some response. And maybe if you're a super tiny person that actually doesn't really need to lose any weight and maybe just using this really for cosmetic purposes and
Yeah.
whatever Tyra Banks is recommending it, well, yeah, okay, maybe that really low dose is all that you need and it's going to be perfect. You lose your 5 pounds, you go to Mexico, good for you. But most of the people that are actually using these medications to help correct this chronic disease and to help them to manage their weight and health, they're going to need more of the drug. And that's
Yeah.
totally okay.